One by one, shot by shot, the equation has not been working in Seattle's favor.
I always come back to that. It's a math problem.
Seattle's police chief says she doesn't have enough bodies to respond to a recent series of shootings. And Mayor Bruce Harrell acknowledges the city's subtraction of officers is still likely to continue.
Although we're recruiting and we have funding to do aggressive recruiting, we're looking at alternative responses.
He stood next to another Seattle chief, Amy Smith, to announce the expansion of the Community Assisted Response and Engagement Team, or CARE, quadrupling the staff thanks to a federal grant that he argues will help to free up cops to react to scenes of violence at a time when the city's own projections show it will lose more police officers than it will hire in 2024.
What can possibly be done to fill that gap right now?
Well, again, as we look at different types of bodies, if you will, we are adding on park rangers to protect our parks. We're adding on care responders to look at where we don't need a gun and badge to free up our officers. And so that's why this is so important. The nearly $2 million we're putting toward this effort.
The CARE pilot, centered downtown with just a handful of employees, responded to over 500 dispatch calls since last fall, with most involving a transport of someone to emergency services. It will now expand citywide. And Harrell said another step could involve physical changes to deter gatherings, like SACA has suggested.
Is that a viable solution given the shortages that you have right now in the city?
Yeah, so we look at what capital improvements can we make, whether there's a speed bump, whether there's a four-way stop we need to do. We look at how we can use technology.
Because as of right now, that public safety pothole is not likely to be filled overnight. In Seattle, Chris Daniels, KOMO News.
In the deep end tonight, more public safety resources are in the works for the city of Seattle. What started as a pilot program made up of a team of mental health professionals will now quadruple in size. Mary Nam joins me now. So Mary, Seattle Mayor Bruce Harrell announced the CARE team is expanding big time.
They really are. The Community Assisted Response and Engagement Team, that's what they're called, is getting some extra hands thanks to a $1.9 million federal grant. I spoke to Chris Daniels about this new development.
This is some good news for the Seattle CARE team, about to quadruple in size. How did this come about, Chris?
Well, it really was because of a federal grant. The city is not saying they're using any additional municipal money on this, that this came strictly from a grant from the federal government to expand this community assistance response team. CARE is the name that they go by, with Amy Smith, who has been an interim chief running it all. The announcement today was that they're going to go from about 6 people on staff to 24 as soon as possible. July, August, the first deputies within that department, for lack of a better description, will be on duty. And what Smith and the Seattle Mayor Bruce Harrell would tell you is this is a unit that is responding to 911 calls that do not require a firefighter to put out a fire or a police officer to show up with a gun and badge. This has been done in a pilot project in downtown. It will expand throughout the course of the city. And the way Harrell would like to talk about this today is this reduces the amount of calls, the workload on the shoulders of police officers, and will allow those officers to then respond to other crimes, which we have seen especially here in the last week with multiple shootings.
Oh, it sounds like the goal is, I mean, once this happens, this will help the police department, already short-staffed, respond to calls and better focus on those big emergencies.
Yes, Smith said today that since they launched the pilot project in September, in the fall of last year, I should say, that they responded to well over 500 calls, primarily people in some sort of distress, mental or physical distress. Majority of the calls, she says, are to transport people to emergency services. That's the kind of work that in the past, perhaps a police officer has gone to, perhaps another first responder has gone to. This is a third public safety unit. And so it doesn't sound like much to go from 6 to 24, but the other aspect of this is there will be a few different people also hired to manage all of this. This will be citywide, 7 days a week, as opposed to 5 days a week for a short amount of time. So the city believes this is a success. This lowers the burden so to speak, on police officers and firefighters, and that this is going to be one of the avenues to get out from this public safety crisis that we have seen in the city of Seattle in terms of the amount of calls and the reduced amount of police officers in the city.
These are trained professionals in their own right, Chris. The funding is there. Do you know if they're going to go up against the same roadblock as far as hiring people and then training them for the role as we have seen in SPD, or are the new employees already on standby, ready to go?
Yeah, that's a fantastic question, Mary, and it did come up today in the course of an hour-long press conference that Amy Smith says she already has people in the queue ready to work. So she thinks that at least a few of them can be hired right away in July and August, and the primary focus out of the gate outside of downtown, she says, will be the Central District and Capitol Hill, where we know, you and I both know, that there's been some high-profile incidents over the last few months. So that is where they're going to be deployed at first, again, responding to 911 calls that are not necessarily violent calls, that are people in distress that people are calling in about. So she says she has people ready to go. The other announcement that came out of this is that Harrell said she has been the interim chief, that he is going to remove the interim title, and she will be the third chief in public safety in Seattle, with, of course, the interim police chief now, Harold Scoggins, who is the fire chief, and now Amy Smith, that he believes she's done a good enough job in this pilot process to earn the job full time. That, of course, though, will need council approval, but based on what we heard today from the public safety chair, Bob Kettle, that's seen as a mere formality. Smith has really been working behind the scenes, getting to know a lot of people, and seems to be well liked at City Hall.
Sounds like this is some great positive news coming out of the city leadership when it comes to public safety in the city.
Yeah, it's something that I don't think if you walked away from the press conference today, you'd say anything negative about. It's hiring people at a time when public safety is the number one issue for a lot of people in Seattle. There's still a question of just when the city can find police officers who are willing to transfer or willing to train in the academy, and what that process is going to look like to get back up to full staff. I mean, I asked Seattle's Mayor Bruce Harrell about that today. What can be done? He immediately pointed to the care team, reducing the burden on the calls to police. He also talked about Rob Saka's ideas in West Seattle, where we saw a fatal shooting over the weekend. The idea of reconfiguring parking lots, adding speed bumps, physical deterrence from people gathering late at night. He seemed to welcome that idea. That's what Saka is talking about. What that kind of cost would look like, where you're going to put that, that's still a big open-ended question. But I think a lot of people objectively in the city of Seattle are looking for ideas, given the fact that the staffing situation doesn't appear like it's going to turn around overnight or in the next year or two, in the very least.
All right. Well, a significant boost for Seattle's care team. Chris Daniels, thanks so much.
You bet.
Mary, hundreds of calls since this team started last fall. What are some of the most common calls that the care team responds to?
Well, they're in all 911 calls, Steve, and they often respond to people in crisis. So we're talking about mental health support. And of course, remember that these are all nonviolent cases as well. And oftentimes it might be really simple assistance, such as providing transportation and connecting people to agencies.
Mary, thank you.